All right. Hey, everybody. Welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa with PAR5 Physical Therapy in Randolph, New Jersey, and I partner with them to bring you an easy and educational workday session. Now, today's session is strength training for golf, core and glute power for a stronger swing. All right. So the core and the glutes are essential for generating power in the golf swing. And we're going to go over a lot of those things today. Why the core strength reduces the risk of back pain. How do we activate these glutes? What kind of exercises are we going to need to improve hip stability and power? And then some of the drills to improve this rotational control so that we maintain our spine angle and have good control and mechanics during the swing. So a little bit about me. I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, and I got my doctorate from Mercer University in 2010. I was let's see here, I got also a BS from Rutgers University, I think back in 1994, it was a while ago. And I'm an orthopedic clinical specialist, certified golf fitness professional and golf fitness instructor, certified dry needling specialist, and also a level 1 certified CrossFit coach. So for the past 15 to 18 years, I guess, I've been treating and seeing golfers here in my clinic and improving the way that they move so that they can feel better and also play better. So let's get into it now. Without further ado, I'm going to pull up my slide. Strength training for golf, core and glute power for a stronger swing. All right, so because I am a medical professional, I have to put up this slide here that all the stuff that we're going to be talking about is aimed at a broad population, all right, the general population. So if you're dealing with something specific, pain, injury, whatever, post-surgery, make sure that you have all the associative factors assessed, get a good physical exam, so that you can understand what the root cause is of your dysfunction and have it addressed by a professional. All right. So if you're dealing with pain and injury, make sure that you seek further advice. Now, the body functions on an alternating pattern of stability and mobility. So specifically for golfers, we want most of the rotation in our swing to go through the thoracic spine and the hips. So those are designed as a mobile segment. Those are mobile segments. Oftentimes, if we lose mobility in those segments over here, our body compensates by changing the role of one of these segments and makes it a mobile segment. All right, so the pattern goes up and down the body like that. You can see the red, blue, red, blue, red, blue, red, blue, red, blue. And the lower back is designed to be stable. And we get that stability through the abdominals, the core muscles, and the lower back muscles. The hips are going to be mobile. The thoracic spine is mobile. Last time, I think last week I was here, we talked about golf mobility exercises. You could look that up, though that video's on demand on the Better Spaces apps. But we're going to also talk about how do we make the club head go fast, right? How do we swing the club? There's this thing called the kinematic sequence, where like a whip, the end of the club is the fastest thing that's moving. But that speed, that power starts from the ground. And we generate that force and torque through the feet, through the legs, through the pelvis, through the torso, through the arm, and then finally into the club, all right? The acceleration that happens, let me pull this up because this is a very interesting chart. The acceleration that happens goes through these segments, the pelvis, thorax, arm, and then the club. And you can see in that gray area right over here, right? You can see my mouse, that this is basically the top of the backswing to impact. And over here is like the backswing. So all the numbers are negative. Everything's going backwards. And on the downswing, this is where we see that acceleration from one segment transferred to the other. So the pelvis, everything moves, but the pelvis accelerates first. It reaches its peak acceleration at that red dot. And then the thorax, the thoracic spine, the mid-back, that reaches peak acceleration shortly thereafter, shortly followed by the arm. And then the sequence continues, and then the acceleration is the fastest at the club at impact. But what happens is that after the peak acceleration for all these segments, there's a deceleration. That kinematic sequence basically means that the force, the speed, the rotational torque is transferred from one to the other. So the pelvis has to slow down to create that stable segment to get transferred to the thorax. The way I look at it is like if you were a swimmer in a pool and you wanted to cheat and get ahead of the guy that's swimming next to you in the next lane, if you're swimming and the way to pass him is to grab that swimmer and pull yourself past him. That's basically what these segments are doing. We're pulling each segment faster and faster so we get that ultimate speed at the club. Now, how do we start that? We start that rotation at the ground, and this is a video of a hockey player hitting a golf club. And you can see as this repeats, as this loop repeats, is that the backswing is pretty quiet. He actually hits the ball into the net, but on the downswing, you could see the rotation that his lower body is performing, which gets transferred to the torso and into the club. For our body, our pelvis to rotate to the left for a right-handed golfer, we need to pull with the trail leg and push with the trail leg like a steering wheel, right? If we wanted to turn the steering wheel one direction, we have to lower one hand or pull one hand and push the other. So that rotation happens in the feet into the ground as we initiate the downswing. And you can see this in the hockey player because he's on skates. There's no friction on the ground. But when we're planted on the ground, the feet don't move that much, and that force is usually not visible. Okay, so the feet do move. We do get a shift from the trail side to the lead side, but the most important force is rotary, not just lateral. Okay, so some key points. What do we need to work on? We need to work on core. The transverse abdominis is the biggest muscle that can give us the lower back stability. It's the deepest abdominal muscle. It wraps around like a girdle, like a back brace, goes from the back and then to the front. And then we have the internal and external obliques. The internal and external obliques, they run diagonally. They're the next level up, and they create a lot of rotation. And then the gluteus medius, the quads and the hamstrings, the leg muscles, the hip muscles, that creates a lot of that stability and strength. So let's get into some exercise, all right? So let me pull up my 2-shot here. And we could start, let's see, you could see me in the mirror, see me in this camera maybe, and then that camera. Let's line things up so you can get the whole thing. So the first thing that we got to do is activate the right muscles. And usually we call this motor control or motor learning. Can we feel or use the right muscles to create the desired movement to create that ultimate effect that we want? So first thing, glutes. Most of the time, people who come in to see me that have back pain, they have a hard time activating the glutes. So here's a simple test. You're going to lie down, get onto your back. All right, both knees are going to be bent. All right, feet about shoulder width apart, knees are kind of like the same width. You're going to put your hands across your chest, and then you're going to lift your hips up. What we want to feel is that we want to be able to get up as high as possible to make a straight line from knee, shoulder, hip, right? So all of this should be straight. Once we're in this position, if we hold this position, we want to feel what muscles are holding us up. What gets fatigued if I held this for a minute, 2 minutes, 3 minutes, half an hour? What are we using? Most of the time, people with back issues feel that they get this movement from the back or the thighs. But ultimately, this movement is not at the knees or the thighs or at the lower back. It's essentially going from a bent hip position to a straight hip position. My knees are not moving as much as my hip is, right? Do we all agree? The muscles that create hip extension or this hip movement right here are not my thighs. All they do is just basically this. They straighten the knee, and they also a little bit raise the leg like this. So that's not the movement that we want. And the back muscles, they basically arch the back. And that's what that muscle does. It does not extend the hip. So first test is this, is that if we hold this position for a minute, we want to feel percentage-wise 90% of the effort of the contraction through the butt cheeks, the glute muscles. That's the first thing. All right, so the first test. If you can't feel that the glutes are active and holding you up in that position, then there's an underlying movement dysfunction that you need to address before we get into all of the next stuff. All right, so the next stuff is going to be how do we get to that position in standing? All right, so if we look essentially at the golf position, golf address position, we get into the shoulder width apart, foot position, and then kind of just make this hip hinge, all right? So I'm here, let's just imagine I have my club here, and I'm holding this position. So I don't know if you could see this, but my back is essentially straight. As I go down, let me see, you could probably see this in the mirror a little bit. When I go into this hip hinge position, my back doesn't round, all right? I start here and I get to this position. My knees stay over my heels or my ankles. I don't want to get to this position, all right? So this hip hinge, right? So it's a dress position here. And if we stood up from this position, it would be here. And that is on a smaller scale what we just did on your back. We need to be competent in using the glutes to be able to get out of this position and get into that down position. And if we make this movement larger and I make more of a hip hinge, I start to get into this hip hinge archetype where I go into an exercise called a deadlift and I pick things up off the ground. This is our first exercise, our first movement archetype to target the glutes. All right, but keep in mind that if you can't perform the bridge motion using the hip muscles, this might not be for you. You need to address that first. All right, that being said, that's a red flag. You could be like, hey, I got to activate my glutes first when I extend my hips in that bridge position that we just did before I do this. If I pick something up off the ground, which is a very functional exercise, and you know what, by the way, a lot of people that come in to see me, I hear this all the time, is that if they have a history of back issues, they actively avoid this movement because they think that it's going to hurt. But it is a functional exercise, a physiological norm that you should be able to do. We have vital signs for our heart rate, our blood pressure, our blood values, right? How much oxygen in our blood, what's our heart rate like, what's our blood pressure like? Those are vital signs, physiological vital signs, but there's also movement vital signs that any human should be able to perform a hip hinge without rounding their back to a depth or range of motion that enables them to pick something up off the ground. Okay, so this is our first exercise to activate the glutes. If we're limited with range of motion or weakness or whatever, we could certainly lighten the load or decrease the range of motion. But we still want the activation, the muscle to do this move, this hip hinging deadlift, to be the glutes, not the lower back. So I keep my spine level, spine straight by activating the abdominals and keeping that locked in as I send my hips back. I get into that deep hip hinge, my shin, again, knee over, ankle, back straight, and I come straight up out of that. So that's our first archetype for that. All right. And then what we could also do is work on strengthening one leg. If that is too intense for you, then a lot of times what I'll program for a lot of my clients is take a lighter weight and we do this with one leg or half of a leg. So the position that we do, what we assume is kind of a kickstand position, but we'll do this with one leg being in that same hip hinge posture, right? So think about like, here's my golf posture. But then I'm going to take the leg that I'm going to not be using. I'm just going to put that toe, heel elevated, close to my other heel. So this is kind of like a kickstand. My right leg is a kickstand. And I could perform the same motion from the top of the motion all the way down, hinging, getting past my knee. If I can touch the ground, perfect. But if I can't, I could limit my range of motion. We could infinitely scale exercises and movements so that you can perform them when we add resistance, so we get the desired stimulus and the effect. But before we do all of that, keep in mind that you need to be able to do a bridge and have your glutes work, not your thighs, not your lower back. So the kickstand variation is basically getting into that same hip hinge, a deeper golf address position, if you will, and still activating the glutes. And for both of these motions, I like somewhere between 8 to 10 repetitions, 4 to 5 sets, so that you're working at a high volume and close to fatigue. You want to be able to push that as long as your mechanics and your consistency with your body mechanics are intact, then we can start to increase the intensity. But the priority is your mechanics, your body mechanics have to be sound and be consistent with those body mechanics, those movements, being able to control your joints under duress, fatigue, right? Speed, whatever. And then we start to increase the intensity by adding weight or some type of other parameter. So the single leg variation, we're going to do that on both legs, right? We want to be even and be strong on both legs. So it's the same thing that I did with that hip hinge. Now, we could progress this to add in more stability and balance. I'm actually wearing the wrong shoes for this, so I'm going to try this out. Running shoes have a higher heel and much softer midsole, so they rob us of stability, but they do give us a lot of cushioning. But it's the same thing, a single-legged Romanian deadlift. So the movement is the same hip hinging that we did with the kickstand variation, but the off leg is 100% off the ground. So I take this and my leg matches, my leg angle in the back matches my trunk angle, right? So I'm going to go down, I kick and move the leg at the same time that I move my trunk. I'm performing that same hip hinging, glute activation, glute strengthening exercise, but I'm also incorporating a lot of balance and control with this. So this is how we program that and progress our glute strengthening exercises, okay? Now, let's get into the core. The core we talked about is the transverse abdominis, which is our deepest abdominal muscles, and accompanied by the internal and external obliques. They create a lot of that stability and rotation that we need. But the first thing, just like with the bridge movement that we did on the ground, to build awareness and control of the glutes, we want to build awareness and control of the abdominals, which control what our spine does, our lower back. So again, we're going to start on the ground, all right? The movement that we're going to do is sometimes called a cat-camel. But with the cat-camel movement, a lot of times people will be excessively rounding and moving the upper back. I want to see, can we activate the abdominals and the lower back muscles and coordinate them to have this motion come more from the pelvis and the lumbar spine? So I'm going to try and keep my shoulders and trunk, thoracic spine, as still as possible. And I activate my lower back muscles to create that arch. My tailbone comes out. And then I'm going to use my abdominals to kind of tuck my tailbone under and round out my lower back. So that's very specific for the lumbar spine. This is a lumbar spine cat-camel. So it's arching and sagging the back. So as you're activating into this direction, right? So I'm going to exaggerate it. If I come up into this position, I'm pushing my spine up to the ceiling. I want to use the abdominals. I should feel that tension in the front line on my belly. And then when I go in the opposite direction, I feel that in my lower back. And when I do that with my lower back, my pelvis also tilts forward, right? Tailbone comes out, tilts forward. And when I reverse that, when I pull my belly button in, activating the abdominals, my pelvis rotates backwards. Okay, so once we have that motor control and awareness of what the pelvis can do, then we transition into another position. So, hey, can I do it in kneeling? All right, so this is essentially the position that I was in on my back with that bridge, right? So I said, hey, we're coming from a hip bend position to a straight position, activating the glutes, stabilizing this. And then can I do the same thing? Can I tilt my pelvis forward, arching the back, creating a little bit of opening in the front here, right? This gets wider. And then can I crunch in, pull this in to tilt my pelvis backwards? So it's the same movement that I got in that quadruped or hands and knees position. Now I'm activating this in an upright or kneeling position. So I feel the abdominals and the glutes turn on, and then when I do this, I feel this turn off, but my lower back turns on. So now I could feel what all this motion is in terms of coordinating the front and back of my core with pelvic control. All right. And then if you got that, then we could start to add load. All right. Being able to do this in this position is like level 2. And then we could start to make it more difficult, get into a plank position and see, can I activate the abdominals and then the lower back muscles to check the mirror to do my tilting, pelvis tucks underneath me. And then my lower back arches, pelvis comes out, tilts forward. And then I come back and forth again, creating that tension through the front and then through the back, controlling my pelvis. So in the plank position, that's a little bit more difficult. And then we could start to apply that into our golf posture. So with golf swings, with consistent golf swings, what inherently happens on the backswing, we get this rotation to the right of the pelvis for a right-handed golfer, but we also get a slight anterior tilt. It's not a lot. We want to avoid excessive anterior tilt because that has its own problems, but there's a slight anterior tilt, maybe like 5 or 10 degrees. And then on the downswing, we rotate to your left, but there's also this posterior tilt, right? That gets you to impact, okay? So that's the motion of the pelvis. We got this little anterior tilt here and then posterior tilt, and that connects what's going on with your lower body to the torso so we don't leak power and stress out the lower back muscles or lower back joints and then transfer that power into the arm and finally into the club. So in standing, we could do the same thing that we just did in our quadruped position and kneeling and in the plank position. Basically get into a 5-iron posture, hands across your chest, and then just see, can we do a tuck and a tilt? So it's here, tucking it in and tilting the pelvis forward. So let me move forward so you can kind of see a little bit here. So I round my back and arch my back. So I'm doing this motion again, abdominals, the lower back, abdominals, lower back. And then at address, we want to be as neutral as possible. So if you're confident and competent with this move, then we start in our mid-range. So we find out, like, how far can I tilt forward? How far can I tilt back? And then start our address position at that neutral so that we can go both directions, arch and tuck at impact. All right. So once we get that, what else do we do to strengthen the core? I think the best exercise they could do that really challenges what we call the transverse plane that rotation and golf lives in is called the pull-off press. So the pull-off press is using any type of band or cable system with a weight right here. I'm using the anchor system. I've got 5 pounds on here. So we don't need a lot of weight on this because it's going to be challenging because we change positions to challenge our stability, not weight. And also hold time. So we're going to get into this high kneeling position that we were before. Find our neutral pelvic tilt position. So I'm going to do a couple of these tilts forward, backward, find my neutral, activate the abdominals, and kind of share that load 360 through the entire barrel. That is my core. And I'm going to take the hands, put them right on my chest, and I am facing 90 degrees away. This is perpendicular, 90 degrees away from this attachment point. So from here, I'm just going to hold that in place. My glutes are engaged, my abdominals are on, and I'm going to take my arms out at 90 degrees. It's right in front of my sternum, right in my midline, and I'm going to hold this. And you could build time up to 20 or 30 seconds. It's basically like an upright plank where we're going in and holding that. This resistance is challenging me to keep this stable because it wants to rotate my torso away. I don't want to overcorrect or undercorrect. I want to build stability. Once we get confident in that position, we can challenge the stability, do it in a half kneeling position. My inside knee is down. I do the same thing, find my neutral posture with my pelvis, activate the core and the lower back muscles, 360 barrel stability, activate my right side glute, and do the same thing. Start on the chest, the sternum, perpendicular press all the way out and hold that position 20 or 30 seconds and see if we can maintain stability and balance there. And then once we're there and confident with that, we can start to aggress those positions in upright. So the theme, I don't know if you've been paying attention, is that we do start on the ground with supported positions, gradually progress into a kneeling or a half kneeling position, and then end, once we're confident with all those levels, in a standing position. So I could do the same thing in golf posture. I'm going to get in my shape here, get my hip hinge, my golf posture, get my everything organized, core, glute, lower back, spine neutral, and I'm going to take this 90 degrees from where my torso is pointing. Again, because I have a forward tilt, my target is horizontal, a little bit downward. It's not horizontal or vertical, it's just right here. So again, 20 to 30 second hold, doing multiple sets, 3 or 4 sets, both directions, left and right. All right, and if you're still wanting more, we could do a split stance and then try and add this. So again, balance, stability. And if you want to be extra sauce in here, we could start to add rotation. But if we add rotation with the torso and the arms, the torso is moving, not just the arms, and my lower body, my pelvis, my abdominals, my legs aren't moving. So that's our final secret sauce exercise where we activate the core, the glutes, and create a lot of power and consistency for our golf swing. All right, so let's pull up our camera here. I think that's all the exercises that we've got today. Hopefully that was all helpful and informative for you guys. All right, so I'm going to open up the floor, use the chat. If you have any questions, let me know. I'm going to give you the 30-second countdown. I want to make this session as informative and helpful as possible. So if you're dying to ask a question, put it in the chat. Oh, you're welcome. Got some thank yous in there. Okay, so 30-second countdown, and then I'll close it out and let you all enjoy your Tuesday afternoon. It's a sunny day out. Hopefully you can get a chance to go out and hit some balls. All right, well, thank you everyone for joining me today. You could see this session, you could look for this session and many more on demand on any of the Better Spaces apps. I will be back Tuesday, May 6th for pickleball mobility, how to keep your lower back and hips pain-free on the court. So pickleball requires quick lateral motions, frequent twisting and bending, all of which that can lead to back or knee pain. You know, the session that we're going to be doing on May 6th is going to be focusing on improving mobility and flexibility to reduce strain and enhance movement on the court. So you'll learn how poor mobility leads to overuse injuries in pickleball, hip and lower back mobility exercises for better motion movement efficiency, some warm-up routines to reduce stiffness and before match, post-game stretching techniques to recover faster, and common mobility mistakes that lead to back pain. All right, so if you have any more questions, you can feel free to email me here at paul@par5pt.com or team@betterspaces.com. All right, thank you for coming and be well.